Have you ever felt a sudden pain in your leg, or noticed unexplained swelling or redness? What if your body was trying to tell you something serious, something you shouldn't ignore? Blood clots are more common than you think, especially as we age. And the scary part: many of the early signs are subtle and often mistaken for something harmless. But knowing what to look for can save your life. In today's video, we'll walk you through the top 5 warning signs of blood clots, with simple explanations, real medical facts, and health tips every senior needs to know. Stick with us, because this is information that could truly protect your heart, your lungs, and your life. Unexplained swelling in the limbs. Swelling in the arms or legs might not seem like a big deal at first, especially if it's mild or only appears now and then. Many people chalk it up to sitting for too long, aging, or just having a bit of fluid retention. But when the swelling is sudden, persistent, and especially if it's just on one side of the body, it could be a red flag. This type of swelling is one of the earliest and most common signs of a blood clot, especially a condition known as deep vein thrombosis, or DVT. DVT happens when a blood clot forms in one of the deep veins, usually in the legs, and blocks blood flow. This causes pressure to build up, which can make the affected leg or arm swell up noticeably. The swelling might come with a feeling of tightness, heaviness, or discomfort. Some people even say it feels like their skin is stretching. It might also make your shoes feel tighter, or cause clothes to fit differently on one leg compared to the other. The key thing to remember is this: if the swelling seems to come out of nowhere, and especially if it's isolated to one limb, you need to pay close attention. The danger with a clot in the leg or arm isn't just the swelling itself. It's what the clot can do next. If it breaks loose and travels to the lungs, it can cause a pulmonary embolism, which is a life-threatening condition. That's why acting early is so important. Doctors say that swelling from a blood clot usually doesn't go away by itself. It lingers or even gets worse with time. Sometimes, elevating the leg might help temporarily, but the swelling often returns quickly. That's a big clue. Another clue is if the swollen area feels warm to the touch, looks redder than usual, or becomes tender. These symptoms together, swelling, warmth, redness, are classic warning signs of a clot. In many cases, the affected leg will also feel firmer than the other. This happens because the blood isn't flowing properly, and pressure builds up under the skin. It's not just about comfort. It's your body trying to alert you that something serious is going on. A medical study published in the Journal of Vascular Surgery found that over 70% of people who were diagnosed with deep vein thrombosis had experienced some degree of swelling beforehand. The problem is that many ignored it, thinking it would go away. That delay can be dangerous. Seniors, especially those with limited mobility, are more at risk of developing blood clots due to slower circulation. If you've recently had surgery, been on bed rest, or taken long trips in a car or plane, your risk goes up even more. The same applies if you're taking certain medications like hormone therapy or have conditions such as heart disease or diabetes. That's why it's so important not to ignore swelling, even if it seems minor. Getting an ultrasound test, which is quick and painless, can help doctors see if there's a clot. And the sooner it's caught, the easier it is to treat with medication and prevent more serious problems. To protect yourself, keep track of any swelling that doesn't go away after a few hours or keeps coming back. Compare both legs or arms regularly. Notice if one is larger, tighter, or looks different. If you're unsure, gently press your thumb into the area and see if it leaves a lasting mark, known as pitting. This can sometimes signal fluid buildup linked to poor circulation or a developing clot. Make sure to tell your doctor right away if you notice anything unusual. The earlier you speak up, the better your chances of avoiding complications. Prevention also plays a big role. Moving your legs often, staying hydrated, and avoiding sitting or lying in one position for too long can all help keep your blood flowing properly. Wearing compression socks if recommended by a doctor can also reduce the risk of clot-related swelling. In short, swelling isn't always harmless. Sometimes, it's the first warning your body gives you that something serious is happening underneath the surface. Persistent leg pain or tenderness. Pain in the leg is one of the most overlooked warning signs of a blood clot. That's because many seniors already deal with aches and discomfort in their legs from arthritis, circulation problems, or just normal aging. But the type of pain that comes from a blood clot is different in some key ways, and recognizing it early can make all the difference. Pain from a clot, especially a deep vein thrombosis, usually starts in the calf. It might feel like a cramp, a charley horse, or even a pulled muscle. But unlike a regular cramp, this pain doesn't go away quickly. It lingers and sometimes gets worse the longer you stand or walk. You might feel pressure in the leg, or a heavy, dull ache that doesn't ease up with rest. In some cases, the pain is sharp and sudden, while in others it builds slowly over time. That's what makes it tricky, because it doesn't always show up the same way in everyone. Another important thing to note is tenderness. This is when an area on your leg feels sore when you touch it or apply even slight pressure. Many people with blood clots say the pain is most noticeable when they press on the calf or back of the knee. This is because the clot is often forming deep in the larger veins, and as it grows, it creates inflammation and pressure that affects nearby tissues. Unlike muscle soreness from exercise, which usually gets better after a day or two, clot-related tenderness doesn't improve on its own. It stays or gets worse, and that's your signal to pay attention. You might also feel like the pain is out of proportion with your recent activity. For example, if you've been resting but your leg still hurts badly, that's not normal and should not be ignored. Medical experts from the American Heart Association stress that leg pain caused by a blood clot is usually focused in one leg, not both. If only one calf or thigh hurts and feels tighter or more painful than the other, it raises suspicion. One leg feeling warmer or appearing darker in color than the other can also go along with this kind of pain. These symptoms may come and go, but they usually return, and each time they do, they feel just a bit worse. If you find yourself limping or avoiding putting weight on that leg, it's a sign that something serious may be going on underneath the surface. And again, this isn't something you should wait to see if it improves. Blood clots are not like pulled muscles, they don't heal on their own without medical help. The longer a clot goes untreated, the greater the risk it could move to your lungs and cause a pulmonary embolism. There are also some specific risk factors that make clot-related leg pain more likely. If you've been inactive for long periods, such as sitting through a long flight, recovering from surgery, or dealing with an illness that keeps you in bed, your blood isn't circulating as well as it should. That slower flow gives clots the perfect conditions to form. Dehydration, smoking, certain medications like hormone replacements, and chronic illnesses like cancer or heart failure also raise the risk. That's why doctors always ask about your lifestyle and medical history when evaluating leg pain. They want to rule out these serious causes before assuming it's something less harmful. A simple ultrasound can often show whether a clot is present, and early treatment with blood thinners can stop it from getting worse or traveling to other parts of your body. To lower your risk, it helps to stay active. Even just walking around your house every hour or so can improve circulation and reduce your chances of developing a clot. If you're watching TV or working on a computer, take short breaks to move your legs, stretch, or even just flex your feet up and down. Staying hydrated helps keep your blood thinner and flowing smoothly. If you start to notice pain in your leg that seems unusual, remember, your body is telling you something. Don't assume it's just soreness or aging. Trust your instincts and talk to your doctor. When it comes to blood clots, it's always better to be cautious. A quick checkup could save you from a serious emergency later. Skin that feels warm or looks red. One of the more subtle but serious signs of a blood clot is when the skin over a certain area becomes noticeably warm or looks red without any clear reason. This often happens in the leg, and it can be easy to overlook at first. You might think it's just a little irritation, a sunburn, or a mild rash. But if the warmth and redness are focused in one area, especially if it's over a vein, it could be a warning sign that a clot is forming underneath the surface. What's happening is that the clot is blocking normal blood flow in a deep vein. That blockage causes pressure to build, and the surrounding tissues react by becoming inflamed. This inflammation shows up on the skin as a patch of redness, warmth, and sometimes slight swelling. The area may feel firm to the touch or even tender, especially compared to the same spot on the other leg. This difference from one leg to the other is an important clue. Sometimes, the skin might look slightly discolored instead of bright red. It may appear dark pink, bluish, or even purplish, depending on your natural skin tone. Doctors say this discoloration can spread or deepen over time if the clot isn't treated. Another thing to watch for is how the area feels. If you touch your leg and one spot feels warmer than the rest, even though you haven't been sitting in the sun or using a heating pad, that could be a sign of a clot. This kind of heat comes from inflammation under the skin, not from an external source. Some people also report a throbbing or pulsing sensation in the area. It may not be painful, but it's a sign that the blood is trying to push through a blocked or narrowed vein, and that effort creates heat. If you notice that the warm, red patch is also becoming swollen or painful, that combination raises the level of concern even more. In many cases, this warm, red skin is the body's first reaction to a clot forming deep in the veins. It's a natural response to the problem, but it shouldn't be ignored. According to a study in the New England Journal of Medicine, about 40% of deep vein thrombosis cases are first spotted because of changes in the skin's temperature or color. That makes it one of the most important early signs, especially for people over 60. Seniors tend to have thinner skin and slower circulation, which means these signs might be more visible or noticeable. But that also means the risk of complications is higher if a clot goes untreated. A clot that causes skin warmth and redness might break off and travel to the lungs, creating a pulmonary embolism. That's why any skin changes like these should be taken seriously, especially if you have other symptoms like swelling or leg pain at the same time. It's also important to know what red or warm skin is not. If you've recently bumped your leg or have a known skin condition like eczema or psoriasis, the redness might be related to that. But if you haven't injured yourself and the skin still looks red and feels warmer than normal, that's different. It could be the early stages of a clot. People with diabetes, circulation problems, or who take certain medications like hormone treatments or chemotherapy drugs need to be even more aware. These factors can all raise the chances of developing a clot, and they can also make skin more reactive. That's why regular self-checks are important. Look at your legs each day. Feel for differences in temperature. Notice if a patch of skin is changing in color or shape. If something seems off and doesn't go away in a day or two, it's time to speak with a healthcare professional. Taking steps to prevent blood clots also helps prevent this kind of skin reaction. Stay active, stretch often, drink plenty of water, and avoid sitting for long hours without moving your legs. If you've been traveling or are recovering from surgery, try to walk as soon as it's safe to do so. If your doctor recommends compression socks, wear them. They help keep blood flowing and reduce the risk of clots forming. But most importantly, listen to your body. When your skin feels hot, looks red, or changes for no clear reason, don't wait. These signs might not seem like much at first, but they're often the first warning that something serious is happening deep inside your veins. Catching a blood clot early is one of the best ways to protect your health and avoid dangerous complications down the road. Sudden shortness of breath or chest pain. Sudden shortness of breath is one of the most alarming signs that a blood clot has moved from your leg or another part of your body and traveled to your lungs. This type of clot is called a pulmonary embolism, and it's extremely serious. When a clot blocks one of the arteries in the lungs, it makes it hard for oxygen to move through your body. You might feel like you can't take a deep breath, or that your chest is tight, even though you haven't done anything physically demanding. Some people say it feels like they've just run a race, even if they're sitting still. This isn't the kind of breathlessness you feel from walking upstairs or being out of shape. It often comes out of nowhere and doesn't go away. You might feel dizzy or lightheaded, or like you're going to faint. That's because your brain isn't getting enough oxygen, and your heart is working overtime trying to pump blood through a blocked system. Chest pain is another major warning sign of a pulmonary embolism. This pain can feel sharp, stabbing, or like pressure in the center of the chest. Some people describe it as a heavy weight sitting on their chest, while others feel it more on one side, especially when they breathe in. If the pain gets worse when you take a deep breath or cough, it's even more concerning. That kind of pain suggests the clot is affecting the lining of your lungs. You might also experience a rapid heartbeat, or feel your heart racing for no clear reason. That's your body trying to push past the blockage and get oxygen moving again. In some cases, people even start coughing up blood or experience a sudden sense of panic, which is your body's way of reacting to the emergency. Medical professionals say that pulmonary embolism is one of the most dangerous results of a blood clot, especially in seniors. It can be fatal if not treated right away. According to the Centers for Disease Control and Prevention, nearly 1/3 of people with undiagnosed or untreated pulmonary embolism don't survive. But when caught early, it can be treated with blood thinners or other interventions that break up the clot and restore normal blood flow. That's why it's so important not to ignore symptoms like sudden shortness of breath or chest pain. Even if you think it might be something less serious like indigestion, it's always better to be safe and get checked. Time matters. The faster you act, the better your chances of recovery and avoiding long-term damage to your lungs or heart. Sometimes these symptoms can be mistaken for a heart attack, especially in older adults. But there are a few key differences. With a heart attack, the pain is often crushing and radiates to the jaw, shoulder, or arm. With a pulmonary embolism, the pain usually stays in the chest and gets worse with breathing or coughing. Still, because the symptoms can overlap, you should never try to figure it out on your own. Call emergency services immediately if you experience sudden chest pain, trouble breathing, or any unusual pressure in your chest. Don't wait to see if it gets better. It's always safer to have a doctor evaluate you right away. An emergency room can run tests like a CT scan or blood work to quickly determine if a clot is present and start treatment. To help prevent pulmonary embolisms, it's important to reduce your risk of developing clots in the first place. That means staying active, drinking enough water, and moving your legs regularly if you've been sitting for a long time. If you've recently had surgery or been hospitalized, ask your doctor if you should be on medication to prevent clots. Compression socks can also help, especially during long travel. But even with all the right prevention steps, a clot can still happen, which is why knowing the signs is so important. Your body will often give you clues when something's wrong. You just need to listen. Shortness of breath and chest pain are not things to ignore. They can be the first signs of a deadly problem, and recognizing them could save your life. If you or someone you know starts having these symptoms, don't wait, get help right away. Unusual headaches, vision changes, or weakness. When most people think about blood clots, they picture leg pain or swelling, but a clot in the brain can be just as dangerous, and in some cases, even more deadly. These kinds of clots can cause a stroke or a transient ischemic attack, sometimes called a mini-stroke. They block the flow of oxygen to the brain, and without oxygen, brain cells begin to die within minutes. That's why it's so important to know the early signs. One of the most common symptoms is a sudden and severe headache. This isn't your average tension headache or something caused by dehydration. It often feels like the worst headache you've ever had, and it can come on very quickly. Some people describe it as a thunderclap, a sharp, stabbing pain that hits out of nowhere. Others say it feels like pressure building up inside the skull, sometimes along with nausea or even vomiting. If a headache seems different from what you usually experience, especially if it's sudden and intense, it's not something to brush off. Another major sign of a blood clot in the brain is vision problems. These can vary widely, which makes them tricky to identify. Some people experience double vision or blurriness, while others might temporarily lose vision in one eye. You might see flashes of light, strange patterns, or even feel like part of your visual field is missing. If your vision changes suddenly, and especially if it's only on one side, it's a strong sign that something serious could be happening. The same goes for confusion or trouble understanding speech. You might find yourself struggling to find the right words, or your words might come out slurred even though you feel alert. These changes are your brain's way of signaling that it isn't getting enough oxygen or blood flow. Physical weakness is another warning sign to take seriously. If you suddenly feel weakness in your face, arm, or leg, especially if it's only on one side of your body, it could mean a clot is affecting part of your brain. This might show up as a drooping smile, difficulty raising your arm, or dragging your foot when you walk. Even numbness or tingling in your fingers or face can be a clue. You may still be able to move, but it might feel like your muscles aren't responding the way they should. These signs can be very subtle at first, but they often progress quickly. If you or someone else starts showing these symptoms, time is critical. Every minute counts when it comes to preventing permanent brain damage or even death. Doctors use a simple tool called the FAST test to help people remember the warning signs of stroke caused by a blood clot. F stands for face. Does one side droop when the person smiles? A is for arms. Can they raise both arms, or does one drift downward? S is for speech. Do their words sound slurred or strange? T is for time. If you see any of these signs, it's time to call emergency services immediately. Getting medical help fast can mean the difference between full recovery and long-term disability. Treatments like clot-busting drugs are most effective when given within the first few hours after symptoms begin, which is why acting quickly is so important. Certain people are at higher risk of developing brain clots. Seniors, especially those with high blood pressure, diabetes, or a history of stroke, need to be extra cautious. People who have irregular heart rhythms like atrial fibrillation are also more likely to develop clots that travel to the brain. If you're on medications that affect blood flow or have recently had surgery, your risk increases too. That's why regular checkups and managing your health conditions are so important. Simple lifestyle habits like keeping your blood pressure in check, eating healthy, staying active, and not smoking can all help reduce your risk. But even with good habits, clots can still happen. That's why it's critical to listen to your body and not ignore sudden changes. A strange headache, blurry vision, slurred words, or unexpected weakness aren't just signs of getting older. They could be signals that your brain isn't getting the blood it needs. Trust your instincts. If something feels off, don't wait. Get checked. The sooner you get help, the better your chances of recovery. Knowing these signs and sharing them with others can help save lives, possibly your own or someone you love. Preventing blood clots before they start. While knowing the warning signs of blood clots is crucial, the best way to stay safe is to prevent them from happening in the first place. Prevention becomes even more important as we age, because seniors naturally have a higher risk of blood clots due to slower circulation, less physical activity, and the presence of other health conditions. The good news is that there are several simple, proven steps you can take every day to reduce your chances of developing a dangerous clot. One of the most important things you can do is stay active. You don't need to run or lift heavy weights, even gentle movement helps. Walking, stretching, or doing light exercises every day can keep your blood flowing smoothly. If you spend a lot of time sitting, like when watching TV or using the computer, try to stand up and walk around every 30 to 60 minutes. Moving your feet up and down or rotating your ankles while seated can also help improve circulation in your legs. Staying hydrated is another key part of clot prevention. When your body is low on fluids, your blood becomes thicker and more likely to clot. Seniors often don't feel as thirsty as younger people, but that doesn't mean their bodies need less water. Make it a habit to drink water throughout the day, even if you don't feel thirsty. Herbal teas, soups, and water-rich fruits and vegetables also count toward your daily hydration. Try to limit drinks that can dehydrate you, like alcohol and caffeinated sodas, especially if you're already at risk for clots. Dehydration and immobility combined can be especially dangerous, so if you're traveling or stuck in bed due to illness or surgery, be extra careful about drinking enough fluids and moving as much as you can. Compression socks are another helpful tool, especially for people who sit or stand for long periods, or who have conditions that affect circulation. These socks gently squeeze the legs to help push blood back toward the heart and prevent it from pooling in the veins. If your doctor recommends them, wear them as directed, especially during travel or recovery from surgery. Speaking of travel, long trips can increase the risk of clots because you sit still for hours. Whether you're in a car, plane, or train, take breaks to move your legs. If you can't get up and walk, do some seated leg exercises like toe taps, heel lifts, and gentle stretches to keep the blood flowing. It's also important to manage any medical conditions that raise your risk of blood clots. This includes high blood pressure, diabetes, heart disease, and obesity. Take your medications exactly as prescribed and work with your doctor to keep your health conditions under control. If you have atrial fibrillation or other heart rhythm problems, your doctor may recommend blood thinners to prevent clots. These medications are very effective, but they need to be taken carefully, so make sure to follow all instructions and go to regular checkups. If you're preparing for surgery or recovering afterward, ask your healthcare provider about clot prevention. They may give you medication, recommend movement plans, or suggest wearing compression gear to help protect you during recovery. Your diet can also play a role in clot prevention. Eating foods rich in omega-3 fatty acids, like salmon, flax seeds, and walnuts, can help reduce inflammation and improve circulation. Leafy green vegetables, berries, garlic, and turmeric are also known for their anti-inflammatory and blood-friendly properties. Try to avoid processed foods, trans fats, and too much salt, as these can all make your blood vessels less healthy. Keeping a healthy weight is another important part of prevention. Extra weight puts more pressure on your veins and increases your risk of clots, especially in the legs. Finally, knowing your personal risk factors is essential. If you've had a clot before, have a family history of clotting disorders, or take medications that affect your blood, you need to be even more aware. Talk to your doctor about your risk and ask what specific steps you should take. Prevention isn't about being perfect. It's about making small, consistent choices that protect your health. Even a few changes can make a big difference. Blood clots are dangerous, but they're also often preventable. By staying active, hydrated, and informed, you can greatly lower your risk and live with more peace of mind. Your health is in your hands, and prevention is one of the most powerful tools you have.